scenario, the patient is a middle-aged man who has fallen and hurt his knee. A nurse practitioner at the Critical Access Hospital is with the patient and conducting a telehealth consult for pain management with a pharmacist at a tertiary hospital. We begin with what should be obvious telehealth etiquette errors.
Oh.
Can you hear me?
Hello?
Dr. Campbell.
Can you hear me?
No, I can't. Hello?
Okay, hold on, give me a minute.
Lots of music in the background. Can you turn that down, please?
You can see me,
See,
right?
like your shirt. I can't see your head, and I hear this god-awful music. Could you please
Hold on, let
turn
me
it
see,
off?
hold up.
There you go, I see you. Hi.
Okay, what can I help you with?
I can't hear a goddamn thing.
You can't hear me?
No.
Okay, is something wrong when you're in?
I'm gonna get out of this hospital and just walk out if you don't turn that shit off.
Who's that?
There's music. I believe it's on your end.
Okay, let me check my mic. Maybe it's me. Check your mic too, okay? I understand you want a consult? Okay, what's up?
You can't
What
hear
you
me.
need?
Can you hear me?
I can hear you fine, yeah.
Are you ready now?
I'm ready, let's go. Talk to me, what's going on?
Did you get the chart on this patient?
Yeah, I got it. Yeah, I have it. Yeah.
I need help managing
got
his
it.
pain. I need you to give me some tips. What do I need to do? Do I need to admit him inpatient? Does he need to go home? What's up?
Oh, for God's sake, don't admit me. I just want some pain meds.
What's his problem? What's going on? You need to look around. Who's this guy walking in? We're having a consult, right? Look behind you.
Sorry, man. We're really busy here. We're in the ER.
Okay, so all right. Let me see if I can find the notes I took from his.
This is a joke. So sorry that you're dealing with this, man.
Can we call somebody else? Can we call, like, a different doctor?
Hey, I'm the only one on staff now, so talk to me, guys. What can I help you with? What's going on?
Basically, what happened is he fell. I don't even really. Poor historian here. He fell down, went boom. He's got a lot of pain, and I got to figure out how to manage his pain. On exam, everything's relatively normal. All the films are coming back negative. He's got a really big history of substance abuse and alcoholism.
Hey.
He's pretty drunk now.
Okay. Okay, so can you repeat that for me? I didn't quite hear all of it.
What part didn't you hear? What did you hear?
What's the patient's name?
It's Odie Granadas.
Okay, can you spell that, please?
O-D-Y Granadas.
Okay.
I just want to get out of here. I just want to get out. Just please, just give me some meds and I'll be out of your hair.
Hold on, guys. Hold on for me. Ah, boy. Hold on. Yes, son. Is it an emergency? It's not an emergency, so I'm talking with a patient now. So let me get back to you, okay? All right, talk to you later. All right. Sorry, guys.
I've got another patient to see.
He only calls. Doc, where you going?
Mrs. Smith, what brings you in today?
Mr. Grandiose, can you stand up, please?
All right, are you back? Are you ready?
You wanted me to stand.
Yeah, I was just having a patient. I want to see him walk. I want to see what's going on. Can you stand up for me, sir? Wow, is that the best you can do?
I'll try to do it.
Guys, I can't see you. You're off. I can't see you guys. Where are you?
We're walking. You told him to walk.
I don't want to walk again. What is this? What kind of visit is this? I didn't want to talk to somebody on TV. What is this?
What's going on, guys? Okay. Can you turn him around now? Hey, Kurt, how you doing, man?
Doing all right.
All right, good seeing you.
Hey man, look, my dispo time's like he's running up. I gotta figure out what we're gonna do with him. You're messing with my bonus, all sorts of stuff. Are we gonna admit him? We're gonna discharge him. I'm writing him a script.
I'm gonna just walk out of here. If you're not gonna help me, I'm going home. I have better things to do with my time.
If we can just, you know, kind of calm down a little bit and let's find out what the problem is.
The problem is I fell, and it hurts, and all I want is some meds.
Okay.
All right, you know what? If you're not going to help me, I'm getting out of here. Goodbye. Thanks for nothing.
Sir? 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 Doc?
Hi, Dr. Campbell. This is Jonathan Taylor, nurse practitioner over at Shore Memorial. I have with us Mr. Granados, who was involved in a car accident today. The reason why I'm calling is I need some help managing his pain. So he's fallen about an hour prior to arrival. For his exam, it's relatively normal. He is a little intoxicated right now, and that's proven by blood work. He does have a history of ETOH abuse and abuse with narcotics, prescription narcotics. The films on him come back are normal also. Neurology saying that he's clear to go home, nothing's going on with his back.
That would be great.
The reason why I'm calling is I need some help managing his pain. NSAIDs aren't working for him. He's had several here. He's had 60 of Toradol IM. I've given him Tylenol, 1,000 milligrams IV. He's not responding to any of that. Obviously, I don't want to give him anything else that's going to snow him, and with his history, I don't want to send him home with a prescription of a narcotic.
Mr. Granados, correct?
Yes, sir.
Can you spell that for me? I just want to make sure I get that correct.
G-R-A.
Sorry, I forgot to ask. You said that you had the consent form, correct?
I did, yep.
Well, my room is secure. You guys are good there?
Well, we really can't. As you can see, there's people walking back and forth. It's an emergency room. We're really busy. I don't really have a way to secure this room.
Okay. Okay. I'll wait. I'm not sure who that was behind you. Okay. Okay, so I think I got the notes here. Can I see the patient walk?
Sure.
Okay, can you stop him right there, please? I would like him to, try to get his balance first, and then he can walk. Looks like he didn't get his balance. Can you help him just a little bit? That didn't look too bad. What medications are you on?
I have high blood pressure and high cholesterol.
And what medication do they give you for high blood pressure and high cholesterol?
I have a pink pill for high blood pressure and a white pill for cholesterol. Sometimes I take the little blue pill too.
Blue?
Yeah, but that's only when the missus wants me to.
Any street drugs?
Not lately.
Any alcohol, Mr. Granados?
Just like a drink or two.
When was the last time you had a drink, Mr. Granados?
I'm sorry?
When was the last time you had a drink?
Before I had the accident.
Okay. All right.
It hurts. I just want something to help with the pain.
Okay. Okay. I understand. I'll tell you what, guys. What I'll do, I'll take a look at your records, and when can we set up another appointment? When are you available next?
But my pain still hurts now. What can you do? Doc, can you talk to him, please?
Yeah, the purpose of the call is to see what you recommend to send him home with, or if we need to admit him for inpatient pain management.
Let's go ahead and admit him. I'll take a look at the records and then I'll get back with you guys shortly.
Okay, sounds great.
All right, guys. See you later.
Hi, Dr. Campbell. This is Jonathan Taylor, a nurse practitioner over at Shore Memorial. Can you hear and see me?
Certainly can. Can you guys hear me?
We can.
Can you see me?
We can.
Good. Okay, so guys, before we get started, you know, with this new technology, having a consent form is very important. So you have consent and your room is secure?
Yes, sir. Room's secure, and we do have consent.
Good. I have the same here, and so we're prepared to help our patient. And our patient is?
This is Mr. Granados, first name Odie.
Mr. Granados, if I can just introduce myself, I'm Dr. Campbell. How are you today, sir?
I've had better days, Dr. Campbell.
Okay, I can understand that, and want to learn, a little bit more about what's going on with you. Now, you may see me, put my head down. I'm not ignoring you, but I want to make sure that I take notes based on our consult today.
All right, this is a newfangled thing, so I'm not quite used to it, but okay.
Yeah, we hear that from a lot of our patients, but fortunately, the good side is that we've been able to help a lot of patients through this technology. Okay? So tell me what's going on.
Just some buddies and me, we went out for a few drinks, just blowing off steam after work. And I missed a step going down the stairs and kind of fell and hurt my knee. So I came in because I was in pain and wanted just some pills, some of those white pills that make me feel good.
Well, I have to believe that the pain that you experienced was bad enough for you to come in, to see someone to get some help. So I can understand that must be hard on you. So I think I do understand the accident that you had, and I do hear your pain. So if you would give me a little bit more information.
Yeah, well, it's my right knee, but I think my left knee's starting to throb too, so I don't know what happened with my left knee.
All right, so your pain is my main concern. We want to take care of you and give you the best services that we can. And I'm really concerned about the pain. Is there any other areas? Is this pain shooting up or down any other limbs or extremities?
It's kind of like right just around the knee, maybe more tender in the kneecap.
And the question that we typically ask, on a scale of 1 to 10, how bad is your pain?
Well, the left knee's probably at a 5, and the right knee's probably at a 8 or 9.
Mr. Granados, I'm very concerned about you right now, and to further evaluate, could you, Dr. Taylor, could you assist him in ambulating, please? Can he ambulate right now?
What does that mean?
We're going to have you walk, if that's okay.
Okay.
Just going to have you walk, Mr. Granados. Not too far. I just want to see your balance and your strength in your lower extremities and your legs. Listen, I have two options for you, Mr. Granados, and if you have any questions on what these options mean, I can explain that to you. But the first thing I'm thinking is, we can start you tonight on some Mobic, and that will kind of ease some of the pain. Or what we could do is admit you tonight and then, provide you with something stronger and observe you overnight and make some different, see what tomorrow brings for you in terms of your pain and how well you're doing.
I don't like hospitals, so if I could get whatever it is that you think I can have at home, I'd rather do that.
Well, I tell you what, that's good because we do like to know what our patients, what they desire and what they like. And so, Dr. Taylor, I think that we know what we need to do for Mr. Granados tonight. So let's go ahead and take care of him. Mr. Granados, do you have any other questions?
No, this has been kind of cool.
Good.
Kind of weird, but kind of cool.
Good. Well, I appreciate that because we implemented this tool, this technology. But listen, I'd like to see you tomorrow, so I'm going to give you my best wishes tonight. You're in Dr. Taylor's hand, and I look forward to seeing you tomorrow.
All right. Thank you.
Have a good night.
Now it's your turn to reflect on these 3 scenarios of the medical consult. Let's summarize in categories what telehealth etiquette mistakes were made and how the provider corrected course. Dr. Campbell is clearly not ready for the telehealth consult. He didn't check out the equipment ahead of time or align the webcam. Test your equipment so you're sure everything is working properly. Check that your head is centered in the screen, also referred to as your canvas, and confirm that both parties can hear and see each other. In the F scene, the provider doesn't ask about the telehealth consent form or whether the rooms are secure to ensure no HIPAA violations. These are both important steps in the process. Make it a habit of confirming this information at the beginning of your telehealth session. In the F scenario, Dr. Campbell wears a very busy patterned shirt. Polka dots, stripes, plaid, herringbone, or any type of crazy pattern should be avoided. They create a moire effect, making lines on the screen look like they're moving, and that can make viewers feel dizzy. Nausea is probably not the effect you want to have on patients during a telehealth consult. So choose clothing that is relatively neutral and limited in patterns. If necessary, put on a lab coat prior to the start of the visit. It's also a good idea to wear a name badge within view of the patient. During the really bad session, there are HIPAA violations on both sides of the telehealth consult, including the patient walking past another patient in bed and an unknown person walking right behind the patient with no curtains drawn. Be sure to confirm that your room is secure and check that the patient is in a private environment. There are many things that can distract patients and providers from having a successful telehealth session. In this medical consult, the desk is cluttered with papers, food, and drinks, and Dr. Campbell had to shuffle through his papers to find the patient chart. Good telehealth etiquette requires your environment to be neat and tidy. That also includes any personal effects, like family photos in the background that may be distracting to the patient. Loud music or sounds are huge distractors. Keep your environment as quiet as possible. No doubt you noticed Dr. Campbell sneak a bite of cookie in the F version of this scenario. He also chews gum and drinks from a water bottle. Think of the telehealth consult as though you are walking into an exam room. You wouldn't eat, drink, or chew gum then, so follow the same etiquette. Fidgety behaviors or habits, like clicking a pen or banging a legal pad against the desk, can be huge distractors, so don't. And turn off your phones, pager, and mobile devices, and mute any other electronics in your environment, like your desktop computer. Your nonverbal communications can speak volumes to a patient. Slight mannerisms that might not be noticed are magnified via telehealth. When you roll your eyes, look down, cover your mouth, or prop your head up, you convey disinterest, distrust, and even boredom. Good eye contact is a critical technique to develop.
We're having a consult, right?
Your words and voice tone can make or break a telehealth visit. Dr. Campbell says,
Okay,
a lot in the F and C scenarios with significant periods of dead space. Start by introducing yourself to the patient and reassuring them about the telehealth process. Explain that you may put your head down when you take notes. He was also incongruent, like when he said,
wow, is that the best you can do?
when the patient ambulates. His tone of voice, condescending. Make sure your words and tone convey concern and that your facial expressions and words match. Professional respect for the provider at the other end of the telehealth consult is just as important as how you treat the patient. So play nice with your colleagues. You need them to help make your telehealth experience successful. And take the time to engage the patient. Small talk at the start of the encounter is helpful. You would do this in a face-to-face encounter. Also, use motivational interviewing techniques to get the patient to talk about what's bothering them and what kind of pain they are experiencing. This helps put them at ease. When you're not bedside, it can be hard to reach out to the patient to show empathy. Things like getting the patient's name right, leaning in and nodding, and smiling when appropriate during a telehealth consult can help. Acknowledge the patient's pain or problem. Use compassionate words and tone of voice, and consider the patient's wishes. All of these techniques help convey empathy. Just like a face-to-face encounter, telehealth consults need a clear beginning, middle, and end. Don't leave the patient hanging like Dr. Campbell does. You can understand why all parties leave totally dissatisfied with the telehealth consult in the F and C scenes. In A, Dr. Campbell, Dr. Taylor, the nurse practitioner at the Critical Access Hospital, and the patient, Mr. Granados, all have a positive experience, even leading the patient to call the session
Kind of cool. Kind of weird, but kind of cool.
Medical telehealth consults require a heightened awareness of how your soft skills and learned bedside manner translate to good screen-side manner. Good telehealth etiquette leads to successful telehealth sessions that can help improve patient outcomes and lower healthcare costs.